Hey teams, Lauren and Rebecca here with Bizrok. In today's video, we're gonna talk about something that nobody wants to talk about, but we have to talk about it, which is one of the most important things in a dental office, which is sterilization.
Yes, it is probably one of the, highlight topics in trainings when it comes to the team saying, hey guys, what are we having an issue in?
Yes.
Where's somewhere that we can help implement some rules and regulations and checklists? I feel like we get sterilization, call me in. That is one of the areas that is always questioned most and asked, how can we help fix things in our sterilization, get things in order, and get some checklists going? And who is responsible for sterilization? That's probably number one. Who's responsible for that? Who needs to actually do the instruments? So it's easy, everyone. The entire team needs to be responsible for sterilization. It definitely doesn't fall on one person. Now, if you have a sterile tech, that's amazing. I am so proud of that office and how
That's a
lucky.
bonus, though.
That is a bonus, and how lucky that team is to have a sterile tech. And I hope that they love on that sterile tech and make sure they understand how important they are and how loved they are by the entire team. But most cases, we do not have a sterile tech in the office. So when we are done with our instruments, you are dropping them and checking out your patient. That is fine, but make sure you come back if that is your protocol. I feel like most of the time people forget to come back and they just think, it's okay, Miss Susie's gonna do them, I don't need to worry about it. That is perfectly fine if Miss Susie's in there and she says, hey, I'll do your instruments. Please say thank you and give her a great hug at the end of the day and tell her how much you appreciate her. But bottom line is that actually is your responsibility.
Yes, well, and you came from a really busy office and you were constantly running in between a couple different rooms and dropping your instruments off to take your patient up front. But your team members also took care of those for you.
Yes.
Now, did you just totally ignore them, or
Never.
would you make a big deal about what they did?
I would. Every single time I'd come back, I would try to find the person that did my instruments, or I would do a quick blanket statement over the intercom or the headset. Thank you for doing my instruments, and leave it at that. But I always want to say thank you. So if you're a hygienist and you are finished with your patient and you quickly want to drop off your instruments because you are running a few minutes behind, the exam took a little longer, or you want to spend that extra time with your patient, that is fine if there's somebody in there and you can ask them, hey, Miss Susie, do you mind? Can you run my instruments for me really quick? It's either going to be a yes, I have plenty of time, or I actually have a patient waiting as well. That is fine. Then you know you need to come back. The problem is forgetting that they're in there, and then the next person comes in sterilization. The ultrasonic is full. There's a stack next to ultrasonic. There's a stack in the sink. The autoclave needs to be run. We just have to get on a schedule. We have to make sure that the instruments are being done, because what we don't want to happen is to run out of instruments and not have what we need sterilized for the procedures in the afternoon and or within the same time frame.
One of the things that I want to touch on, because we see this a lot whenever we go into our practices, will you touch on kind of the rules around sterilization, especially when it comes to the pouches that we're setting our instruments in? Because we've seen a few of those that were not done correctly here recently.
Yes. So if you are looking at your sterile pouches, there is the dotted line. We have to make sure that when we are taking the sterile tape off to fold the envelopes to seal them, that we only fold on that dotted line. I think a lot of times in our head we're thinking, if the instrument is this big and the pouch is this big, we're going to fold the pouch a little bit larger than it needs to be over, then it's actually not sealed properly. So if we can fold it on the dotted line and make sure that it's sealed properly, then we will be in regulation with OSHA and our instruments will be sterilized.
Awesome. Well, thank you guys for your time today. If you need any help or guidance on sterilization protocols, as always, please reach out. We'd be more than happy to help you. As always, guys, otherwise we can't wait to see you and serve you soon.